Hey everyone, this is Nurse Ryan, and today we're going to be talking about the drugs Levodopa and Carbidopa, also known as Levocarb. Levocarb is often sold under the brand names Sinemet and Duodopa. You can use the timestamps in the video description to jump ahead. Levocarb is most commonly used in the symptomatic treatment of Parkinson's disease. It can also be used in the treatment of restless leg syndrome and others. But before we talk about how Levocarb works, let's quickly review Parkinson's disease itself. Now, just covering the basics, Parkinson's disease is caused by the degeneration of dopamine-producing neurons. Basically, when the brain is not producing enough dopamine. Dopamine is a very important neurotransmitter in the brain, and without adequate levels, we can start to see the symptoms of Parkinson's disease. For example, lack of dopamine can cause tremors, bradykinesia or slowed movement, shuffled gait, speech and cognitive impairment, and more. Parkinson's is a chronic and progressive disorder, meaning it will only get worse over time and is currently incurable. But like we mentioned, Levocarb can be used in the symptomatic treatment of Parkinson's disease, hopefully decreasing the symptoms mentioned. So now, how does the Levodopa Carbidopa combo work? First, let's start with Levodopa. Levodopa is simply a precursor to dopamine. When someone takes levodopa, it is able to cross the blood-brain barrier where it can be metabolized into dopamine. And remember, Parkinson's occurs due to the lack of dopamine, so levodopa is able to supplement dopamine levels. The problem with administering just levodopa on its own is that it can metabolize into dopamine before it has even had a chance to reach the brain. And we really don't want this to happen because dopamine itself actually cannot cross the blood-brain barrier, so we wouldn't get enough dopamine to the brain this way. This is where carbidopa comes into play. Carbidopa basically just holds on to and protects levodopa. It prevents the early metabolism of levodopa. The thing is, carbidopa, like dopamine, cannot pass through the blood-brain barrier, so its protection of levodopa only lasts up until the blood-brain barrier. So once levodopa passes through, it can then be metabolized into dopamine, which is what we wanted all along, more dopamine to the brain. So one last time to sum everything up. Levodopa and carbidopa are administered and enter into the bloodstream. Carbidopa prevents the early conversion of levodopa into dopamine. Eventually, the combo finds their way to the blood-brain barrier. Levodopa passes through and carbidopa cannot follow. The now free levodopa in the brain is easily converted into dopamine, and more dopamine equals fewer Parkinson's symptoms. So that's the basics of how the combo of levodopa and carbidopa works. Now, there are many possible side effects of Levocarb, so we'll just go over some of them here. Levocarb may cause hypotension or low blood pressure, which may manifest as dizziness, fatigue, weakness, and more. With long-term use, Levocarb may cause darker urine, saliva, and sweat. This seems to be a harmless effect, with the only concern being that it may cause discoloration of clothing over time. Levocarb may cause all sorts of mental disturbances, just some of which include hallucinations, psychosis, and impulsive behaviors. And it can also cause a life-threatening reaction called neuroleptic malignant syndrome, or NMS, which presents as high fever, confusion, tachycardia, muscle rigidity, and can lead to further complications like rhabdomyolysis, kidney failure, and seizures. Levocarb is contraindicated with non-selective monoamine oxidase inhibitors, or MAOIs for short. MAOIs must be discontinued at least 2 weeks before starting Levocarb. Levocarb is also contraindicated with narrow-angle glaucoma, those with undiagnosed skin lesions, and in those with a history of melanoma. Protein may decrease the absorption of Levocarb, reducing the amount that gets into circulation. So teach patients with Parkinson's to avoid changes in protein consumption without consulting their primary healthcare provider. If Levocarb causes GI distress like stomach aches, it can be taken with food, but again, avoid high-protein snacks or meals around the time that Levocarb is going to be taken. Regular kidney, liver, and blood tests are often performed during extended therapy of Levocarb. In many institutions, nurses are expected to administer most medications within about 1 hour of the ordered time. So for example, if a medication is ordered for 10 o'clock, The nurse is expected to give the medication between 9 o'clock and 11 o'clock, sometime within that frame. That's within 1 hour before or after the ordered time. However, it is very important to administer immediate release Levocarb within 30 minutes of the ordered time to best manage the symptoms of Parkinson's disease. The timing of Levocarb administration can make a big difference in the onset and severity of the symptoms. Levocarb is also available as a gel, which can be administered constantly throughout the day and night via a PEG-J tube called Duodopa Intestinal Gel Therapy. And that's about it for the basics of Levocarb. If this video has helped you out, please consider leaving a like and subscribe. I would really appreciate it. If you have any questions or would like me to review a specific drug or topic, please let me know in the comments, and thanks for watching.